Back to Dr. von Schwarz. So migraines can be debilitating. Migraine headaches affecting women 4 times more than men, mostly during their reproductive years. And new research is out showing the connection between migraines and cardiovascular disease. And cardiologist Dr. Ernst von Schwarz back with us. So what is the tie here between the two?
There's a couple, Joe. Thanks for bringing that up. One is that migraine is a combination of the vascular and the neurologic disorder, meaning it affects the brain, of course, but there is also some point with the vascular system. And what is common with atherosclerosis and cardiovascular diseases is what we call endothelial dysfunction, which is basically a dysfunction of the affected in patients with coronary disease, with people who develop heart attacks and strokes, and that has been shown similar in migraine patients. In addition to that, there's an increased platelet aggregation. Platelets are those tiny substances in the blood which are responsible for the formation of clots. So patients with migraines, in particular women, have a higher propensity to develop those clots, and that puts them at higher risk for thromboembolic complications, meaning strokes and heart attacks. And there's other reasons, of course. For example, in particular with those migraine patients who have what we call an aura, which is like prodromy lasting for an hour with focal neurologic deficits. In particular, those women and few men, they are considered at extreme high risk.
Dr. Von Schwarz, thank you for joining us and giving us a little insight there with migraines and cardiovascular health as well. We appreciate you joining us.